Thank you for joining us. I'm Mary Minetti, Senior Policy and Program Specialist from the Institute for Patient and Family Centered Care. And you've joined us for another PFCC Connect informal conversation. Our topic today is moving toward family presence across healthcare settings, supporting the frontline workers. I'm joined by my colleague Marie Abraham, who is our Vice President of Programming and Publications, and she will be our chat moderator and sharing some links and things in the chat. And then of course, we would not be able to do this at all without our wonderful Natasha Reed, who is our technical support person. So if you have any concerns about your technology in terms of not being able to hear or other kinds of things like that, she's your go-to person, either through the chat or I think that there's a phone number that you can contact to get a hold of her. And Natasha, if you can put that in the chat, that would be great. So you have a poll in front of you, and we're going to give you just another minute or so to fill out the poll that talks about the role. We are excited to chat today about the importance of supporting frontline workers as we move hopefully toward family presence across healthcare settings. And we know that things in some parts of the country and some parts of the world are heating up with the COVID variant. So this is a concern and may be delaying some changes or reestablishment of family presence policies, but we'll have an opportunity to chat about that. Hannah, I see that you don't see the poll. I'm going to ask that.
There are others who can't see the poll as well, Mary. So I just.
Oh, okay.
Well, I have everyone except for 6 people have responded. So
okay, great.
I think the important thing to note is that once we respond to the poll, it does disappear. It'll pop back up with results though.
Okay. Well, looks like it's popping up with the results. About half of you are coordinators responsible for patient and family centered care. And we've got a good contingent of patient, resident, or family advisors, as well as some patient experience folks. And it's always great as a quality improvement staff person, which is my background, to see QI folks. And thank you, risk and safety people and clinicians and administrator leaders. You know, it takes a village to do this work. And so we appreciate the diversity of people that are involved with us. If we can go to the next slide. For those of you that may not have joined us in the past, I see that a number of people, because of Marie's chat, have chatted in your name and organization and country. We have 4 polls this time because not only do we want to know what your role is, but we're interested in knowing what's happening in your setting as well, just to kind of take a pulse on those kinds of things. We will be loading all of our resources into PFCC Connect folder, and really our purpose isn't for me to present a lot of information, but rather to facilitate a conversation among all of us about this very important topic. If we can go to the next slide, Natasha. So your setting and where you're working or contributing as an advisor is important to understand where the bulk of the attention might be spent on this conversation. Although you may be in a primary care setting and there may not be a lot of others from a primary care setting, but we want to talk about this issue as it relates to all settings today. So everyone is valued and welcome to contribute to the conversation. And while we're waiting for everyone to fill out the poll, if you still can't view the poll, please let Natasha know. And Natasha will let us know when we've got enough responses on the poll to see what the results are. I don't know about those of you from other parts of the world in the country, but we have lavender blooming in the Willamette Valley of Oregon, and the bumblebees are just busy having a lot of fun with the lavender. So I don't know how many of you are supporting bees in your communities, but they need all the support that they can get. Okay, so 2/3 of us are from hospitals and medical centers, which can involve ambulatory practices. We've got some primary care folks. I'm always grateful to see people from assisted living or continuing care communities, because that is a area that was hit particularly hard by COVID initially, and also is the area where family presence is particularly important. So we'll go to the next slide. So I don't know if any of you are following just the information, and there's lots that's coming out about COVID, but you can see that over time there have been a number of articles, and these are just recent ones, really talking about the impact of separating patients and families because of the COVID virus, and that it's really causing a lot of harm and suffering. There are a number of forums and blogs that are beginning to say it's time for hospitals and nursing homes and other places to really open back up and really begin to welcome families into their patients' and residents' lives, because of the important impact it has on quality of life, emotional, as well as physical healing. And yet there still is a lot of resistance to making that change. Next slide. And this was a recent article by MedPage Today about physicians really being fed up with the fact that there's such inconsistent visitation policies, and that a number of critical care experts are saying that this really is causing way too much harm. And it's been going on for over a year. And I know that there's a lot of fatigue about COVID, as well as a lot of anxiety, but it is really important for us to begin to have these conversations and think through how we can support frontline workers as well as patients and families in all of these settings to encourage the return to what was true before the pandemic, which is many places really embraced family presence and welcomed and encouraged and integrated family members into the care team across all of these settings. Next slide. I'm interested in, this is a beautiful waterfall in Oregon taken by my primary care doc, but we're interested in knowing what's the current policy related to family presence in your community, in your organization. And you can check any that apply. And these were just some of the ones that I was aware of that are out there. And note that with the poll, you're going to need to scroll down to see all the options. But we're kind of just taking a pulse on where things are at across the continuum of those of you that have joined us for this conversation.
I'm going to give this just a few more seconds, Mary.
Okay, I appreciate it. There's a lot of words to read through on that particular poll, so it's good to give people enough time. Scott, I appreciate you mentioning in the chat what is happening in the setting that you're working in. Okay, so let's see where we're at across the organization. So 67% are encouraging family caregivers, and that's a majority of those of you that completed the poll, and so that's really great. And that for those that are vaccinated, they're welcoming interactions and presence. and with the birth of children, um, or when children are hospitalized. But there's still a 15% where it varies widely. And I'm so glad that there are no one on this call where the COVID restrictions are still in place and no family or visitors are allowed. So that becomes important. And I think an interesting comment and question was in chat was, are we finding a disconnect between the policies and practices at the point of care? And I'm wondering what people are experiencing. Do you have one policy, but yet what's happening at the bedside or in the nursing home is different? Anyone's welcome to share their perspective.
Hi, Mary. It's Chris Mayhew from Alberta Health Services.
Hi.
Yeah, I think we're, of course, a provincial entity, over 100,000 staff and physicians, and I think we've recognized while we have one guidance and directive, we have seen variation across the organization. That we've of course tried to support kind of consistency, but in reality it's difficult to have that consistency across the board.
So do you think that the variation is just because of the size of your organization, or is it based on science, or is it based on concern or fear in terms of
I think you have the answer probably all above in some ways. I think some of it, there are situations, and we've sort of acknowledged in our guidance that people may need to make more restrictive measures in place if there are outbreaks, etc. But then we also know that there is potentially some cultural elements in terms of leadership at different sites, and so there may be more or less sort of risk tolerance based on the experience that they've had. They may have experienced an outbreak, and I think it's really led to some trauma and moral distress amongst staff that probably makes it more difficult to kind of ascribe to the level of access that we would hope for.
Yeah, I can see that would be the case. And Jennifer mentions in the chat that outbreak areas are areas where the policy and the practice shows some inconsistency. And Valentina, I love that you're working closely with your patient and family advisors and staff to ensure that we meet everyone's needs. Let's go to the next slide, because that's what I wanted to really shift to at this point. Is we have a variety of practices. The majority are starting to open up and welcome family presence, which I think is really important. And the focus of this conversation really is, yes, we really value family presence, and how do we transition back in a way that really supports the healthcare workers, those that are on the front lines, who have really hard jobs, who are feeling really frustrated. I know there have been a lot of articles, and I was listening to PBS last night about how frustrated doctors and nurses on the front lines are with the lack of vaccinations and the increase in the Delta virus, and the fact that hospitals are starting to fill back up. They have been there for the last year and a half, and when it felt like things were starting to let up, then this Delta variant kind of threw a monkey wrench in the works. So if we can do go to the next slide and then launch this poll, I'm really interested in and this poll is about what is it that our organizations are doing to really support frontline workers, because I really want to focus our attention on the conversation related to that and really share some best practices. So let's see what's happening. And again, this poll is one where you need to scroll to see all the options that are available, and please check any that apply. Oh, apparently
Mary,
it's
can you
not
check one?
allowing us to check more than one. Having a little technology challenges today. I'm sorry about that. The technology gods are not on our side. So check the one that is most prevalent in your setting, and we'll, I appreciated that Hannah just checked all of the above, that her organization is really working across the board to really assist individuals to be supported, both in terms of leadership and in terms of providing additional support, virtual and face-to-face. And I agree with Marie, Chad, and any other responses that may be true that I didn't think of or haven't heard of in terms of supporting staff and frontline workers. Should we give this just a little more time? Okay. Thanks. Okay. And knowing that a number of you checked all of the above, and we forced you, unfortunately, through technology to have to choose the one that was most appropriate. It looked like employee assistance programs are up and running, and there have been some opportunities for some stress reduction activities. And I think that the comment that was made about how difficult it is, Lillian made this comment that in busy ICUs, the staff often can't get away to utilize some of the things that are in place to support people. And that really is a concern, isn't it? So if we can just take a minute before we go to the questions that came up, as we think about the things that are assisting frontline workers, I'm curious and invite people to share what have frontline workers felt have been the most effective ways to support them during this long period of time that we've been challenged with COVID-19. And while you guys are thinking about that, I just need to make a quick change to my hearing aid because the battery is going and it's driving me crazy. Chris, do you want to talk a little bit about your family presence community of practice?
Sure, I can. So actually prior to COVID, we were working quite actively on new policy around family presence in Alberta Health Services, and we had established community of practice as a way for folks to share some of the challenges, the learnings, the successes across the organization. So it's in a large organization, it's not a huge group, but it's really a lot of folks that are representing family presence in their area. So a lot of coordinators, a lot of managers, etc. And we get together on a monthly basis and just really talk about the implementation. And so when COVID came along, we were actually doing it. Previously, we were doing it every 2 months. And when COVID came along, we talked with the group and actually increased our frequency to monthly. And through that venue, we were really much better able to get a sense of what things were looking like, on the front line, and to really understand some of the challenges and try to feed that information sort of into our development around our COVID guidance and et cetera. So it was a really valuable group to kind of gauge their experience and knowledge, and where the level that I work, and Jennifer Simon, who's on the call as well, my colleague, is really to inform the policy. We're part of a task force group with AHS that has helped develop the guidance. So just a really good forum for folks.
Great, great. Barbara, you talked a little bit about an annual employee picnic. Can you talk a little bit about that and how that impacted stress and support for frontline staff?
Hi, everyone. So at the PFAC meeting is usually the second Wednesday of every month. And this month in July, we moved it by 1 week because that was the date of the annual picnic that they always have. Well, in the past, it's been sort of stuffy with, senior staff doing the food and that sort of a thing, and long lines. But this year they really shook it up a lot because of COVID-19, and so they had 20 food trucks. There was live music, but the thing that I thought was really most interesting was that they had 20 different piñatas made out of the COVID-19 cell. And so it was just funky looking, and people just beat them with with sticks and destroyed them totally. So it was a stress reduction and also a lot of fun. And it was round the clock. And of course, there were lots of units where people couldn't come down. And so then they took orders and took the food back up. But it was a lot of fun. So it was super, super great for the staff. And I think for the organization as a whole, it was sort of a healing time. And that was really nice to hear. And because we've talked about at PFAC about how injured the staff are. And so it was really great to see that as a moment of recognition of the pain and agony that people have been through.
Yeah, yeah. April, you talk a little bit about a small task force that's doing some quarterly things. You want to share a little bit more about that, please?
Hi, sure. So our child life department in particular, we created, it's called Seeds for Smiles. So it's a group of 4 of us within our own department that are developing different stress relieving activities. So for example, we actually just did one earlier this week where our task force put together, so we're at the Jersey Shore. So we put together some beach bags for all of our team members. And in the bag were little staples for the beach. So like a beach towel, sunglasses, sunscreen. And then we also gave them jars that they can then use to fill with sand or seashells, and really encouraging them to, whenever they can, just take some time to step away and go to the beach. And then in addition to that, we did a virtual lunch and learn. So we ordered sandwiches to go with the beach theme. And then our coordinator led a beach meditation, and we did a summer themed virtual trivia game. So our whole department was able to kind of take an hour lunch and just have fun and play together. And then they have this beach resource to kind of encourage them to get out to the beach when they have time off. So that was our most recent one. So we're doing these quarterly, and they've been very well received, very successful. Everybody seems to be really enjoying that time, even if it's just an hour. But yeah,
that's wonderful. So creative. I love the sandwich idea. So Hannah, you made a comment about St. Jude providing some special COVID holidays. Can you talk a little bit more about that? It may be that Hannah is not in a place where she can speak.
Can y'all hear me?
Oh, I can now, yes.
Okay, good. So St. Jude has had several COVID holidays, which were basically days that anybody that, wasn't absolutely necessary to be at the hospital had a mandatory holiday. And oftentimes they paired that holiday with other holiday days to kind of extend, like Thanksgiving break and spring break and things like that. And they were just an encouragement to take a self-care day. And so just the fact that the hospital felt it was that important that they gave us extra holidays just, I think, meant a lot to me and several of my coworkers.
Oh, I bet. And Jennifer, it looks like you've got a PTO model where frontline staff were able to have some flexibility in their schedules so that they didn't have to use their PTO. Do you want to share any more about that? That may be a different model than.
Yeah, it's pretty straightforward. It was just something our organization was able to execute house-wide in terms of all of our frontline clinicians. So I think in years past, if you had a sniffle or a cough, you maybe would wear a mask and still treat patients. But with COVID, it was really, I think, very thoughtful in the way that our organization executed it. They expressed it saying that, if you are at all having any symptoms or need to go get a COVID test, like, don't stress over trying to prioritize work and just really take care of yourself. And it was also out of respect, of course, out of our patients. But I think having that message and also flexibility to not feel stressed about using your own PTO to like go take care of yourself, I think was a great model that a lot of our frontline clinicians appreciated, to be able to balance a lot of the stress that we've been under for the past year and a half.
Good. Yeah, it is really important to recognize that stress that's been present for a long time really takes its toll, and that we need to be mindful on an ongoing basis about organizations being supportive and recognizing and flexible. And to that point, Lillian, you made a number of chats, and I'm wondering if you want to just share anything in particular that you found has been helpful in your organization, because it looks like they've done a variety of things, some bonus time or something. Tell us more about that.
Yeah, so I work for Memorial Hermann in Houston. Can you hear me?
You're a little light. Can you turn up your volume a little? Maybe I should turn mine up. Go ahead.
Okay, that's as high as it goes. Is that better?
Oh, yes, it is.
Okay, so they did offer all the employees in the system a bonus simply for being employed. And if you were vaccinated, there was an additional amount because they have not made vaccinations mandatory yet. The payroll advances were a wonderful thing. So if anybody's spouse, for instance, wasn't working, then we had an opportunity twice so far to get a payroll advance and pay it back very slowly. And it was significant, a couple of $1,000s if you needed it. And then, like Jennifer, we did not have to use our PTO. So if you were sick or had any symptoms or whatever, you just stayed off and the hospital took care of it. And, for myself, who happened to get pneumonia in addition to my COVID, I was off for close to 2 months and didn't have to use 1 minute of my PTO, and that was lovely. So I think it was, very generous for an organization with 30,000 employees.
Well, that's great. And Lisa Muma, I noticed that one of the things that your organization did was really had a way of recognizing through reflection, honoring patients and staff who were lost to COVID. Is that something that you guys did on a regular basis or just a one-time only? I think you're on mute, Lisa. And you can't figure out how to get off. Oh, that's so frustrating. Well, if you figure it out, just break in at any point, and we will learn a little bit more about that. I appreciate you sharing the idea. Oh, there you are. You're off mute.
Oh, I'm off mute. Okay, can you hear me?
I can.
Okay, excellent. Yes, we held a moment of reflection just to support our staff who had we lost so many patients throughout our health system. We have 8 hospitals, and we did this simultaneously throughout the 8 hospitals. Everyone was given a small bell when they came to work that day, and we had our chief nurse speak, and everyone was given that opportunity to just spend a little bit of time either together or out on their units. And we rang our bell, and we have a bell choir that is coordinated by one of our PFAs. So we videotaped them for a minute, and they played their bells for a minute, and that was the part of the time where we did our bell. And it was very, very well received. People out on the unit could shake, their little bell in their pocket or wherever they happen to be and watch this on their computer as well to be able to participate. So we did it at the same time at all of our hospitals, just so that we could remember and honor our patients and their families. well received. We just did it once. We did it in August last year, but we really felt we needed something to get our staff together to be able to do that. The other thing that we did recently through our nursing departments at just one of our hospitals so far, though we are going to roll it out, is we did what we call a Beaumont breakfast box. We encouraged our staff, so many of our employees, spouses were out of work, children are home that may have been getting breakfast at school. So we had those who wished to donate non-perishable breakfast items, and we packed boxes of breakfast food and we distributed them to our employees. Anyone who wanted to pick up a breakfast box to take home could do so. And we had enough donated to do 130 boxes with our first one, 110 with our second one, and they were gone in 2 hours. No questions asked, just drive up, we pop it in your car, you don't have to fill out any paperwork, didn't have to show your badge, just pop your trunk, we pop it in and off you go. Extremely well received. And we really learned that we had a food insecurity issue among our own colleagues. Mm-hmm. It was our colleagues supporting each other. Extremely well received.
Oh, that's a great idea. Thank you for sharing, Lisa. I'm glad you figured out how to get off mute.
Thank you.
So, Lillian, you are talking about Code Lilac, and somebody else was talking about lavender, Code Lavender. So can you, or Sharon, who also was talking about Code Lavender, want to share about that process and what that did to support frontline staff?
Sure. Our Code Lilac started in the pediatric ICU years ago, and it originally was started with a group of the chaplains and some staff members that were trained in bereavement. And it started out as a time to step away when we would have particularly high acuity or an abnormal number of deaths in a short period of time on the unit, because no matter how sick a child is and how merciful it may seem for them to finally be done with their fight, it's still out of order. And having children die is not the same as having an 80-year-old grandma die. So anyway, it's very hard on us. And so they have been doing this for a while, and they would bring snacks and coffee and, good smelling stuff like aromatherapy and that kind of thing, and light candles. And even though I'm sure candles are not supposed to be in the hospital, but we did. And there would be places for us to just chat or just be quiet, or sometimes they would have a round table and actually talk about some things regarding how we are feeling, not necessarily a debriefing about a case, but just how we're feeling. And so when COVID happened, it was more just because of the stress of the hospital being so busy and the uncertainty and the staffing. And so we have continued that, and chaplaincy has kind of expanded their role of doing this for us and the rest of the Children's Hospital. I assume they're doing it on the adult side as well, just for support. So it's been really lovely.
Great, thank you. And Sharon added a little bit more detail in the chat related to their Code Lavender, which is in the process of being introduced. Chris, it sounds like you guys have a recognition services that's really related to kind of bringing attention to and supporting some exceptional staff work. Can you share a little bit more about that?
Yeah, for sure. I mean, as part of our normal process, we have what's called the President's Excellence Awards, and they're quite a robust process in terms of filling out forms and getting nominations and different things like that. And for COVID, there was sort of a recognition that that was just too much for people in terms of the amount of time it would take, and just obviously a lot of the other pressures. So the recognition services really simplified the process. Just a quick application to tell us a little bit about who the program was, what was exceptional about sort of the work they were doing, and so they received the nominations, and in large part there's some sort of acknowledgement. There's still a judging process a little bit in terms of some criteria, but certainly there's always recognition, and then there's a process for acknowledging in terms of plaques or pizzas to really to yeah, just to really celebrate the work that has been done. You're on mute, Mary.
Sorry, I've got a
No worries.
page a ladder around me, so I don't normally put myself on mute. Thanks for bringing that to my attention, Chris.
Yeah.
Sharon, tell us about your recognition program, Cheers for Peers, and your comms team. It sounds like there's a couple really good practices there.
Yeah, so Cheers for Peers was before the pandemic. We have a group at the hospital called HEART, and it stands for Headwaters Engagement Action Recognition Team. And it's actually peer-led. So it's staff and staff members who actually look at how ways to recognize the team. And we do events every single month. And we've been doing this now for over 2 years, nearly 3 years, I think. We actually have, we walk around with like our baseball caps on and a pin so people know that we're a member of the HEART committee. But we devised a program called Cheers for Peers, which is a recognition program that we run. And we do this in 2 ways. We do it electronically. So someone can go on our intranet and fill out a form that basically sends an e-card to a member of staff, and it's based on our values of kindness, passion, courage, and teamwork. So we can just drop a line quickly and the manager is copied in, so they get to see that the staff member who's got the recognition. Or we can fill out a little handwritten card and just leave that on people's desks and things like that. So we do a lot through Cheers for Peers. But also our comms team, they started probably maybe 2 months ago, a section in our monthly newsletter called the COVID Chronicles. And basically they ask members of staff or our patient family advisors or volunteers, you know, how's things been for you during the pandemic? And they're able to reflect and put a 1-page story together with a photograph of their experiences during the pandemic. So that's really helped people sort of get things out of their head a little bit and be able to reflect. So that's been really great as well. So like they're 2 things I know we've used consistently to try and help. The other one, also while I'm on a roll, the other one we've used is we have a thing called the kindness cart. So through the HEART program, we do this every Christmas anyway. We used to always call it the treat trolley at Christmas, and we'd stack it up on all goodies. So now with COVID, we make sure everything's individually wrapped and everything, but that goes out once a month out to the departments and teams just to say thank you and, you know, give them healthy little snacks, etc. And just so that people know that, you know, they're thought of.
Great. Sounds like wonderful recognition, and it sounds like you have a rhythm to it.
Yeah.
Allows it to be kind of embedded into kind of the fabric of appreciation and recognition and gratitude. That's wonderful.
Yeah. And it's been quite successful and people come and go from it. I mean, I was the chair for 2 years and I've stood down as chair now, so give someone else a chance to do the chair piece. But it's really grown from strength to strength. And people absolutely love it. And like I say, we try and do events every single month.
That's wonderful. Great. Well, I'm going to ask Natasha to switch from the Sunrise in Oregon to some questions that came up. These are the things that people were interested in talking about. We had so much to talk about just from chat. We have spent a fair amount of time on that, and I've learned some really great things, and there's some best practices out there that we want to share more broadly. So thank you everyone who's contributed so far, both in chat and in talking out loud about them. But these are the kinds of things that came up for people. And in terms of staff support issues, there was some concern about how we manage staff fears to create a desire to reopen. And is there something we can learn about the resistance that maybe staff have to, you know, reopening, because we want to address those issues respectfully and not force people, but really prepare people to move forward. So I'm curious what kinds of strategies, and a number of you, 67% said that you have opened in some ways to really invite and support family presence. So it may be that you've got some strategies that you put in place to deal with initial resistance. And we've learned a lot about how to support frontline workers. But I'm curious what kinds of strategies people were or have used to not just deal with the staff stress, but to deal with any concerns or issues that staff might have about getting back to full family presence across any settings, whether it's nursing home, because we have some people from continuing care communities, as well as the hospital. So what have people done to strategize and to support?
Mary, while people are thinking about this, Barbara sent me several photographs of the piñata, the COVID piñata. If I can share my screen, I'd love to just share them while people are thinking about their responses to this. Natasha, can you help make me able to share my screen?
1 second.
Yep. Thanks, Barbara, for doing that.
There you go, Marie.
Very fun.
Can you see that? Okay, let me go to another one.
I love that one.
Okay.
Thanks for sharing that, Marie.
Well, thanks to Barbara.
It was quite a partnership.
So, you know, this is Lillian. It's interesting in my hospital because we are a pediatric, because we're a children's hospital. We want the parents to come because, you know, the babies are not happy when they're not there. And it's been difficult because, especially for the kiddos that are COVID positive, when the parents come in, they really need to stay because chances are if the baby has it, the parents have it, right? And so when those parents come in, we usually allow only one parent for a known COVID positive child. And that's hard on the parents because they have no support, but we do feed them. We provide a caregiver tray for them that they do not have to pay for, 3 meals a day. And we, you know, part of my role is to make rounds on the family. So, and I also make door signs for all of the kids that have their names on them. Let me show one to you. Can y'all see that? Anyway.
Yeah, I can see that.
Okay. Yeah. So anyway, so I'll usually go to the door, and in the ICU, the doors have glass windows, and you know, I'll stand and talk to them so that they can see my face, and so they know that one of the people that's rounding on them, they know who I am, and stuff. But you know, we generally limit the number of people in the room visiting face to face when it's a known positive COVID patient. So it's difficult. We're always looking for an exception to the rule, even though we know that it's a risk. But these kids need their parents, so and the nurses need the parents.
Yeah, of course. So it sounds like there have been some chats related to digital visitor scheduling to reduce the effort required of RNs. I think anytime you add something, it's nice to be able to reduce demand in other areas. So Kim, that's a great example. Are there other kinds of things that people are doing to deal with the hesitancy and guidance? Sharon, do you have some thoughts?
I suppose, Kim, I think I'm going to be honest. I don't think we've really thought about it as a question as you've just posed it. And now I'm thinking it is something we should be thinking about, as to, we keep thinking about the effects on the patients and the families and all of that. But now my mind is really switching over to the have we really asked our staff about why there's this hesitancy? Because we know there is. I mean, I certainly know that there is. And I agree with Kim, a lot of it comes through infection prevention and control and the balance and, you know, looking for guidance like we've had all this time that keeps coming out. And then you think, okay, here's the new guidance. We'll go with this now. So I think people have got quite used to waiting for that approval to do certain things, and the hesitancy is a lot to do with that, like who's going to do that first and what are our peers doing? Because I know nearly every week I'm emailing my peer group saying, where are you up to? What are you doing? You know, so I think a lot of the hesitancy comes from that. And then I think on the staffing level, and I'm going to now think about this a bit more and go out, but I do think it's just that exhaustion piece and thinking, okay, we've now got to shift gears and change again and go back. And I don't think it's because staff don't want the families or the loved ones there. I think, again, there's that concern about physical constraints and space and PPE and everything else that comes with that, and how to manage that when you've got staffing concerns as well at the same time. So I think there's a lot to take into consideration. But with regard to like, what are we doing to help the staff? I certainly know I've seen a good example from I think it was a local hospital, it might have been, I can't remember who it was. It was on one of these type of talks where they talked about a strategy of 3 steps, which was something like pause, reflect, reset. And, you know, they rolled that out with their teams to say, just take a minute and think about things. So I'm not saying we're not doing things, but probably haven't put the effort into asking them questions as much as we need to.
Mm-hmm. Mm-hmm. It is really important to open up the dialogue and to hear what's behind the resistance or the hesitancy, because generally there is something that needs to be addressed. And sometimes when we try to push through, even when our intentions are well-meaning, that it often pushing through without having those dialogues can create more resistance. And when we remember before the pandemic, it seems like it's been here forever, but when we remember before the pandemic, the reality is that most nursing staff and frontline workers were very supportive of family presence and had a real camaraderie and connection to caregivers who came in and supported their loved ones who were hospitalized, or who supported family members who came into nursing homes or assisted living facilities to be with their family members. And then the pandemic kind of turned everybody upside down on their heads, and now we just need to regain our equilibrium. We need to use the science, and we need to listen to what individuals have to say so that we can address those issues really importantly. Has anyone on the call actually engaged caregivers and frontline workers in conversations around pros and cons of opening and different changes in policy and procedure?
Mary, I can comment and say our PFAP has been instrumental in our policy development and creation. So certainly every time we want to make a change or think about things need to change, we always go to them. And they've been very supportive and have told us, you know, but they're also very cautious. I will say that. I think a lot of the time they're more cautious than we expect them to be. So yeah, they've certainly helped us as we've moved along.
Great, good. Others? Any other comments related to any of the questions on this slide? I've got another slide with additional questions that came up for people that registered for the conversation. And I want to make sure we at least get eyes on all the questions so that if people have things that they want to share, they can. Well, hearing no further comments on these questions, let's go to the next. This really has to do with one question that came up that I thought was very specific related to family presence is what ways can we address visitor presence, family presence within space limitations that restrict the distancing? Any of the hospitals on the, or the nursing home folks on the calls with shared rooms, how have you dealt with that? Sounds like maybe we don't have anyone on the call that.
I think, you know, in AHS, we've recognized that space is different and our sites are, you know, vastly different. We have some sites that are newer builds that, you know, can probably accommodate that space and distance. And we have some sites that are quite old and really space is quite a limit. Early on in COVID, I would say probably last summer, we started to recognize that households sharing the same house didn't need to physically distance from each other. And that made a big difference in how they can be present and partner and participate in care. And I think that that was a really important move for us to say that these guys are our family, they live in the same house, they're supporting each other outside, they've come to us for a service and they'll be supporting each other when they go home, and to try to make that distinction. You know, did everybody see that same opportunity? Probably not. And definitely as the pandemic, you know, it wasn't so much keeping that person separate from the patient, but keeping them that physical distance from staff or that physical distance from other people that might be coming into the room was the biggest challenge. But we've really asked people to not think about space as yes or no, but yes and how, like where can space be, how much space is actually needed, you know, how much space does it take for a chair and a handhold, and so, you know, what, you know, are there other places that we could find space? So, you know, we've really struggled with allowing just social visits in, recognizing that that really puts a big burden on the space. And so, you know, we've really moved social visitation to outdoor spaces. In Canada, that doesn't really work well in the winter. So, you know, people kind of self-select not to do that. And we ended up having a quite a large wave 3 around that same time anyhow for COVID. So it was time to pull back on those social visitations. But coming into summer again now, we're back to looking at those outdoor spaces and outdoor visitation as a way for people to find space in safe ways.
That's wonderful. And I love the comment that you made. It was yes and how. And that language really kind of shifts how we have the conversation. When we say, yes, we're moving in this direction, and how might we do it? And then engaging people in that. So thanks for sharing that. There's a lot of information happening on chat in terms of the science of, you know, what are we learning about spread from individuals who come in? And Jennifer, I think you made this comment. In your organization, caregivers and visitors accounted for only 1% of COVID spread to staff. So, and then Deborah, I think you said that there are some findings from the Netherlands that actually suggest that the caregivers did not increase the spread. So we do want to keep our eye on the science as well as the conversations about what people are comfortable doing and those kinds of things. Let's talk for a minute about leadership engagement. I know that Sharon mentioned and Barbara mentioned that PFAs have been very much involved in their organizations in terms of participating in conversations related to changes in policy and practice and how to do it and those kinds of things. Are there any insights about great ways to be able to make the case to senior leadership that family presence and patient voice can be a strategic priority? What have been people's experiences?
It's Chris. I'll take a shot at this one, but you know, throughout our process, we've been working with our provincial patient and family advisory group in terms of our policy development. And when COVID did strike, they were well prepared around family presence, you know, and so we really worked with them to help define what family presence could look like during COVID. And those recommendations went straight through to our emergency command center at the time. And it was a really strong impetus because I think they're well acknowledged and respected in the organization. And because we went to them with that voice and they helped give us, their, expectations, it really, I think, did add emphasis to the need to create that reintegration. So it was a really important partnership and really helped facilitate, I think, their voice to really move on it.
And I noticed that there's a lot of conversation about how organizations are approaching the thought of engaging family caregivers in asking about vaccination status and things, and how that can be a bit tricky, and we need to be respectful of their privacy, and that it's not necessarily a mandate that gets asked, but that is an issue as we continue to move down this road of learning together about how to maintain partnership despite a continuing pandemic. So I cannot believe it, but it's 4 minutes till we're going to end, and I have just a couple things I need to share with you. So one is that we'd love for you all to save the date and share the date. We do have an upcoming webinar on August 25th of this year, which is next month, about a month away, at noon for 90 minutes, called Better Together, Recommitting to Family Presence. And we are going to highlight some organizations that have, in a partnership way, really looked at engaging staff and clinicians and PFAs and others in looking at family presence policies and practices and how to recommit to that. So when you get your link to the recording and the chat, we will also be sure to send you the link to register for that webinar if that's something that you would like to participate in. Next slide, Natasha. We do want to bring to your attention that we do have all of our resources available in one area on our website related to COVID and patient and family-centered care, including a number of documents, one of which is our family presence decision-making guide, which was a tool that was created in partnership with an ethicist and others. And Marie just put the link to be able to download that if that's something of interest to you. Next slide, Natasha. We will make sure that you get all the information from today's conversation. We are encouraging you to complete an evaluation. For those of you who are not members of PFCC Connect, which is a free learning community, the conversation continues in that virtual space where people can add additional links or materials related to this conversation, and we encourage you to join that. Next slide. For those of you that just are visual learners, this is what it looks like in PFCC Connect, where there's a list of folders for the individual conversations, and you can click on today's topic, and that's where the link to additional resources and materials and things will be, and where you can load other things. And of course, Natasha continues to be a wonderful technological resource. So if you have something that's an example that you would like to have shared there, we encourage you to let her know if you're having some difficulty in loading that up. Next slide. This has been an absolutely fantastic conversation. So many of you had great ideas and suggestions and best practices of things that you're doing to support frontline staff. And I really appreciate you sharing them. The more that we can share with each other what's working and what we're grappling with, the better that the field can move along and really sustain partnerships across the continuum, so that as we respond to the pandemic, we remember how important our partnerships and our relationships are to providing the very best quality of care across the continuum. So Please give us ideas about other topics we can cover in our PFCC Connect conversations on that, in that survey. And you can certainly contact me directly. Thank you so much, everyone, for joining us. Have a great rest of your day and be safe out there.